Good morning, everybody, and welcome to November's Health Innovation Community Partnership meeting. We're really excited to be with you today on this 4th of November. Quite a lot of wonderful things happening in the community. We're happy to be able to share with you today. As we go ahead and get started, just a few reminder announcements. Please mute your microphone unless you are speaking. We always love when you enable your camera so we can share this space together. And we ask that everyone click on the interpretation button to select the language of your choice. That is the button located at the bottom of the screen, the globe for interpretation. You have the options of participating in our meeting either in English or in Spanish. We also want to make sure this is an interactive session, so please feel free to add comments and questions in the chat. At the appropriate moment, me or one of my team members will read them aloud and make sure we get your questions responded to. We also want to make sure to mention, of course, that this meeting is being recorded and our recordings are always posted a week or two after the meeting on our hicpla.org website. With that, we're going to go ahead and dive right into our meeting. Here's a quick look at our agenda for the day. We'll be going over our, this is me going over our agenda for the day. Then we'll have an update from Jorge Orozco, our CEO of the hospital, telling us a little bit about the happenings at the LAC USC Medical Center. We have a wonderful community health presentation from a couple of the doctors in our gender health program at LAC USC. We'll have an update on the General Hospital West Campus, as well as development updates on various projects and development initiatives in the community. Finally, we're going to conclude with a conversation about civic leadership and what's going on and how it impacts the work at HICP and how we support our communities through this challenging time. We'll close with partner announcements. With that, I'll go ahead and get started with our HICP guiding principles. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. With that, I'd like to to announce some of the happenings of the week on our campus. As we know, Monday, Tuesday, we're Dia de los Muertos. We have, and it still is up and available for people to come by and view, a beautiful Dia de los Muertos altar in the administrative lobby of the Wellness Center. We invite anyone from the community to come visit us and participate in the altar experience. We also want to make an announcement that it is our last chance for members of the Health Innovation Community Partnership to submit their applications and join the Community Priorities Advisory Committee. We have extended the deadline through Monday, November 7th. So please feel free, if you are interested in helping really identify the priorities of the community to impact the future development at General Hospital and West Campus, please put your name in the hat. The link is available on the hicpla.org website. We invite everyone who is interested to apply. And we wanted to make a final announcement that tonight at the Wellness Center, we'll be hosting a screening of the movie Encanto. We're excited to have a community health fair beginning at 5:30 to 6:30, featuring many of the providers at the Wellness Center on the campus. So come, if you're interested, please let us know. I think we still have a few tickets available, although space is running out. And then the movie is showing at 7 o'clock on the steps of the historic General Hospital. With that, I will pass the podium along to our wonderful CEO, Jorge Orozco, to lead us through some updates of what's going on the campus. Jorge.
Hi, good morning. It's amazing. It's already November Time is flying. But I'm really happy to be here to just present a few thoughts about what's going on our campus. Is there a next slide, please? Next. COVID. Not much to say there. Fortunately, we've been seeing a continued drop in positive tests in our admissions. And the majority of our patients who are admitted with a positive test are not there because of COVID. They're there for other medical reasons. And so this is good. You know, we are seeing an uptick in influenza-like illnesses, and I think that's certainly a concern. And there's always a concern of an uptick in COVID resurgence, just like what happened the last couple of years. So we're still vigilant, we're still ready for any surges, but hopefully it won't be as bad as it has been the last couple of years. Next. So I also wanted to just provide a brief update on our rebranding initiative. As I've shared here at HICP, the hospital has started and is well into the process of rebranding the hospital. The primary driver has been a huge amount of confusion by our patients, the community, media, on our current name, LAC-USC, which happens to be right across the street from USC Keck Medical Center. And I tell you, on a daily basis, I run into people lost on our campus looking for an appointment, whether it's they're on our campus looking for an appointment that really is at Keck, and I hear vice versa. There's our patients who go across the street and looking for an appointment on our campus. So it is a significant issue that we need to resolve. We took this on with the intention of being rooted in a research-driven process that reflects the input of our patients, of our staff, of our community. And to that end, we've completed over 2,000 surveys of patients, staff, and community members, general community members, and over 48 hours of focus groups, in-person focus groups. So we have a significant amount of input already that has informed the selection of our new name. We also wanted to continue to strengthen the trust with our patients and our community post-pandemic, and also reflect our mission to building a healthy community and pushing the boundaries of health outside of the medical center and into our community. So we've started this research process and focus groups. We've worked with research experts to interpret the results, and we've learned that our comprehensive medical center is of greatest benefits to our patients and community. And so we're at the point where we have selected a new name for the hospital. Our new name will speak to the rich history of the medical center and the roots that it has in our community. USC will not be in our name, but the affiliation with the university will be clearly conveyed. Our relationship with USC has not changed, but USC will not be in the name, largely because of the confusion that currently exists. We are adding a tagline to our hospital name, our medical center name, that will reflect our mission of building healthy communities and being a trusted partner. And we are working with branding experts to look at the font, look at the colors, etc. We are planning a big reveal, a big event to reveal our new name sometime late January. We still have not confirmed the date. But we are very, very excited. This is a lot of work. As you can see in my virtual background, you know, we need to change all the labels across our medical center, all the monument signs, all the wayfinding signs that are currently branded as LEC-USC, all clinic appointments, you know, so this is a huge, huge initiative. And so we're working very, very hard to prepare for this, but we are very, very excited about our future and our future brand and our future connections with our community. And with that, I'll open it up to any questions that anyone might have.
Does anyone have any questions for Jorge?
Hi, this is Monica. I actually have two questions. One is regarding like the flu or the cold that's going around. I've noticed that I have a couple of people or I know a couple of people that are getting sick, and it seems like that it's harsher. Like they have a really bad cough, and it's just like longer that they're going through this, and then like 2 days in they feel even worse. Is that like because we haven't really had like the cold or flu season, you know, like last time or like last year? And then the other thing is, I just want to say I'm really excited about the brand name. I don't know, but in my mind, I think I know what the name is. But I'm very excited about that.
All right, Monica, let's see. I'm going to start a pool. Yeah, you know, I'm not a medical expert on, you know, the cold and flu season. But I think there has been a significant uptick in childhood, in children's flu-like illnesses and symptoms. And, you know, the last few years, everyone's been wearing masks. You know, off and on in different places, but now hardly anyone is wearing masks. I think the hospital environment is probably one of the few locations that continues to require masks. So I think that allows, you know, these viruses to spread. But I don't know if there's any sort of medical personnel on the call that can talk to severity of illness.
We do have an upcoming presentation by a couple doctors in your hospital, and I don't know if our medical director, Dr. Carla Gonzalez, is on the call with us as well.
Hi, everybody. Good morning.
Morning.
It's nice to see everybody so early in the morning on this cold day. I agree. There's a lot of colds and flus going on. And I've said this group has also heard me say this before. Viruses are back, and it's not just COVID now. We're dealing with all the viruses, all the good old-fashioned colds that we had before, RSV, parainfluenza. There's a lot of kiddos as well. You know, I think people are trying to do the best to balance their life after 2 years of a pandemic, and we are seeing a lot of people just, you know, forget about how great masks work and even hand hygiene. I'm gonna say the same thing you guys have heard me say before. We need to do our best to, you know, if we're not feeling well, staying home, hand washing, getting our vaccines. We've seen plenty of sick people at this point in the urgent care, not from COVID, but from flu. COVID's still out there, but flu, influenza A, and of course, those of us who have kids and deal with kids, we know that, you know, at school it's really inevitable. It's very challenging. I feel so bad for the teachers as well this year, but I think doing our best with hand hygiene, and you know, when we're still having the mask wearing here on our campus. I'm still wearing my mask when I go out and when I travel, and I'm still actually having my own daughter, as much as she can, wear her mask as often as she can, and hand washing. She's getting vaccinated at our event tonight, the Encanto event, and she's getting her booster, and she already has her flu vaccine. So I just want to reiterate that to everybody.
Thank you, Carla. I think we have one more question from Juana. Just as a note and a reminder to everyone, particularly if you joined a little late, we do offer simultaneous English-Spanish translation in our meetings. So please make sure everyone, regardless of your language preference, to select the globe in the bottom so that you can fully participate in our meeting. And with that, Juana, please ask your question.
Buenos días a todos. Quiero, no es pregunta, hacer un comentario y yo sé que el señor Orozco va a tomar cartas en el asunto. Ayer estuve en la sala de emergencias en la tarde y lo que miré es el trato que le dan a las personas cuando no traen la mascarilla. No son, principalmente los security no son amables en decirles, tenemos una mascarilla para que la pueda usar. Y eso yo lo veo mal porque ya llegan enfermos, ¿verdad? Ahí al hospital. Y recibir ese trato por parte del security, pues ya hace sentir más mal. Aparte que también algunos de los enfermeros por estar en estrés todo el día, de estar prestando ahí su gran servicio que hacen, no es bueno y sí quería ver si pueden darse una vuelta y ver que tengan suficientes mascarillas, pero principalmente el trato que le dan a las personas.
Muchas gracias, Juana. Pues eso no es aceptable. Necesitamos pues tratar a todos con respeto y sí, vamos a investigar eso un poquito más para acordar a nuestro security que es su trabajo de servicio a nuestra comunidad y vamos a mejorar eso.
Muchas gracias. Yo sé que usted y todo el equipo que lo conforman hacen un excelente trabajo y como le dije el otro día que lo vi, gracias y siempre de mi parte va a ser un gracias eterno.
Gracias a ti, Juana.
Thank you so much for your comments, Juana. Any other questions for Jorge or for Dr. Carla, who stepped up to the microphone as well? All right. Well, we're so excited to see the new opportunities presented by a rebranding opportunity, Jorge, and like you say, kind of clearing up that confusion for our patients and community that are seeking care at our fabulous medical center. We also just want to mention that in the month ahead in December, there's going to be a lot of wonderful events happening at the campus. I'm sure we'll be doing more of an announcement at our next HICP meeting, but please stay tuned for a World AIDS Day celebration as well as our annual tree lighting ceremony. So there's a lot of cool stuff always going on the campus, and we're so excited to invite you all out to participate and enjoy with us. With that, I think we'll say thank you again, Jorge, and we'll see you in a month. All right. So I'm delighted to be able to welcome to the HICP space Drs. Tracy Semko and Catherine Gardner from the LAC USC Medical Center that are going to give us a community health update on the gender health program and gender affirming services that are provided through the Department of Health Services. With that, I'd like to invite Dr. Semko and Dr. Gardner to please take it away.
Hi, good morning. Good morning, everybody. Honored to be here and share about our services. We're here representing the gender health program, and actually, you can go ahead on to the next slide, and I'll take away slide number 2 officially. I like to put up this picture because I think it's actually a really good description of where we are as a program. We are. While we have existed for a long time, we are in a process of really changing and growing. And I would say, I kind of like to say where we are right now is maybe this one that's sort of number 3 in this line. It's a process. We've got a leg sticking out over here. You can definitely see that there's some direction that we're going in, but we're still in process. And we're really happy to share where we are in this process, because just because we are in process doesn't mean that we're not, that things aren't happening, and absolutely things are happening. We have services to offer our patients. We're linking people to care, and really proud of where we are right now and proud of where we're going. So we'll go on to the next slide. And go ahead, Tracy.
So I'm Tracy, she and her pronouns. So who we see, I mean, the really short answer to this is we see anybody who could be seen at DHS, but basically anyone with Medi-Cal, and if they have My Health LA, we can see them in consultation, like if their primary care sends a referral. We cannot see like outside referrals if they are not currently being seen at DHS for other services, with the exception of the My Health LA at this time.
So we'll break it down a little bit further into, really who it is that we are seeing and who can come and access services here within our program. But again, if you want a very short answer, the short answer is anybody who can be seen at DHS can be seen in our program. So we see people of all ages. We see children, adolescents, adults. From a clinician's perspective, from our shoes, it's such an honor to be there, because what people need at different points in their lives is different, and being able to see how just how people access care, what they're needing around gender affirming services as they age and as life happens, is a really fantastic thing. And it's really wonderful to be able to provide those different services at those different points in people's lives. We'll go on to the next slide. And this is our who we see payer wise, which is always a horrible word for it. I hate that word, but that is, I think, the official word for what kind of coverage do you have? That might be insurance coverage. That might just be you're part of a program that pays for your medical care. So that's what that means when we use payer mix, which is, again, that's a horrible word. So who are those folks who can come see us? So as Dr. Samko said, Medi-Cal, and specifically, we see a lot of people that have LA Care and HealthNet. We have what's called straight Medi-Cal, as well as folks who have restricted Medi-Cal. We have people who have My Health LA. We are seeing them in terms of specialty care and services. So that's referrals from their primary doctors who are most likely an FQHC. But again, we're not doing their primary care. We're just seeing them for specialty consultation. We're also seeing folks who are uninsured. They're usually enrolled in one of LA County Department of Health Services programs, like the ability to pay program, where there's a reduced cost of services or no cost depending on the person's income. So
we also see some unique populations. So we do see minors involved in DCFS care. So if a child is out in the DCFS system, their social worker can give them a provider to our, a referral to our clinic. And then we see minors who are involved in the juvenile justice system. We also do get referrals from correctional health. So for adults in correctional health. So we can see all of those populations as well.
So what services do we provide? And again, like I mentioned a little bit earlier, what is right for one person is going to be very different for the person next door. And really what that depends on are so many factors, age including. And so what are the services we do offer? What's sort of our menu that people may consider? So one, which is common probably to everybody, is really a lot of discussion around gender, exploration of what is right for them, what makes most sense at the time. It may be something, it may be nothing, but really a lot of talking is one of the things that's probably most common and universal amongst all of our patients that we see in our clinic. We do offer prescription medications such as hormones, puberty blockers, puberty suppression. There's surgical services that are offered and provided at LA County Department of Health Services, and specifically at LAC-USC, which now is going to have a new name to be announced. So there's what's called top surgery. There are restrictions around this, and our services are provided to adults only within our health system. Breast augmentation, facial feminization, and tracheal shave hysterectomy, orchiectomy, voice surgery. And then there's non-surgical things like voice training and therapy that we do as well within within DHS. You can see over here on the right side of the screen, you have images of two of our locations. LAC-USC is the original location and by far the largest of where we operate. That's run by Dr. Tracy Samko. I'm over there working with her on Mondays. And then there's a smaller, but again, growing clinic within our program at Hubert Humphrey in South Los Angeles.
Just a quick note, presenters. I just wanted to make an announcement that we have a new Spanish language interpreter joining us today, Edgar Maldonado, but it is his first day. So we're asking everyone to please be a little measured in our speech across all of the presenters and people asking questions. Let Edgar take a breath now and then. Thank you so much for the wonderful content. But yes, if we could slow our pace, that would be greatly appreciated.
My apologies all. Thank you for the reminder, and thank you, Edgar.
Not at all. Your passion shines through, and we love the content. So that's all good.
So there are some services that we do not have within DHS, and that for those with insurance, we can refer out. So unfortunately, this does not apply to people who have the ability to pay, or to people who have restricted Medi-Cal, unfortunately, at this time. And those services include electrolysis, so hair removal, as well as laser hair removal, although we can do some laser hair removal within DHS, but electrolysis, unfortunately, we do not offer. Top surgery, so our surgeons have some restrictions around the body mass index. So for people who are at a higher body mass index, we can refer them out. And then as Dr. Gardner mentioned, our surgeons are adult only. So in selected cases for youth who desire a top surgery, we would refer them out to Children's Hospital Los Angeles. And then the bottom surgeries, the complex bottom surgeries, which include phalloplasty, metoidioplasty, and vaginoplasty. Those are not services that we can currently do at this time within DHS. So we refer all of those patients out to providers in the community. And then body contouring, so body shaping procedures are not a procedure that our surgeons feel comfortable performing. So we refer those out as well. So how to link people to care? That's always the question, right? So you can we can see patients with a referral from a PCP within DHS. So if you have a PCP, they can send a referral through our eConsult portal. That's the typical referral pathway. A referral from an FQHC PCP. So again, the eConsult pathway is the best way to do that. Our linkage is called the Transgender and Gender Management Portal. If they're looking for the specific thing to click, that's what it is. You can also, if you're a patient and you're not sure, you can call the Alexis Project front desk, and our phone number is right there. And if you're not sure if you qualify for services, one of our case managers will talk to you about your current insurance coverage, what insurance coverage you would need to be able to be seen at the clinic. If that's something that you desire to do, they can facilitate the transfer process, if they're having issues accessing service at whatever system or insurance provider that they're currently accessing. So the phone call, or you can email one of us. So those are our emails there, me and Catherine, me and Dr. Gardner. We are happy to answer any emails. I will say, we are just individual providers. So sometimes our inboxes get pretty full. So if you sent an email and you didn't get a reply, it's not that we didn't want to reply to you. It's that it got lost, and please just send another one. Like, it's not bombarding. It's just like, if a week's gone by and you didn't get a response, it wasn't you, it was us. We missed it. We're so sorry. Please send us another email.
Before we move on from this slide, do you want to give a little overview of what the Alexis Project is?
Sure. So the Alexis Project is just our name. I apologize that we weren't more explicit about it earlier up. It's just the name for our LGBTQ service clinic at LACUSC. So we are a public-private partnership. We have, our public partnership is county, and our private partnership is with the Alexis Arquette Family Foundation. So Alexis Arquette was a transgender activist and actress, and she sadly passed away of complications from HIV. And her family was looking to get involved with the trans community, and they very kindly made a donation to our program. And actually, we have an ongoing partnership with them. So we are named in Alexis Arquette's honor, and we continue to have access to some outside funding that allows us to do things that are outside of the scope of usual medical services, but that can be really affirming to a person's gender identity. Things like binders for people with chest dysphoria. So we have those available to give to patients. We can provide money for makeup or clothing that is more gender affirming. We've gotten patients access to hair services to be more gender affirming. So things that are very important to affirming a person's identity, but are not traditionally covered by like medical insurance services.
Okay, there we go. I think we're at the end of the formal presentation. So now we'd love to open it up to questions from the community that want to know a little bit more about the program, the services, or the points of access. Who has a question for Dr. Samko and Gardner? You're welcome to raise your hand or put a question or comment in the chat. We'd love to hear from you. Well, while we let the audience come to a question, I know one of the questions that prompted us to invite you here today was the concern about the lack of gender affirming services and the restrictions that are growing across other places in our country, and how Los Angeles County might be in a position to be responsive and supportive of people from outside of our area. And I wonder what you may have seen, heard, or conversations you're part of in that regard.
Absolutely.
You want to go first, Catherine?
Sure. Yeah. It is absolutely something which is directly impacting transgender, non-binary, gender diverse people across the country. With that, services have always been extremely challenging to access. In some ways, sadly, while this is nothing new, it's also something that's very loud, and the repercussions, whether or not you're in a location which does restrict access to those services or not, are felt pretty significantly. Where we are within California, we have not experienced any types of restrictions to our services. But again, that knowledge, that discourse on a national level does directly impact the people that we are seeing in our clinical environment and spaces, whether it's mental health, struggles with accessing employment, education, that type of thing. Where we are within a system to address and respond as, again, these not just conversations, but legislation happens. We continue as a program to advocate for our patients, for our staff, for each other, to be able to access care and work in an environment which is both supportive and also, in a dream world, celebratory. And so as we access, or as we advocate, we work to really elevate voices, really try to make sure that again, while this is amplified, it's also nothing new. And so making sure that we continue to advocate, continue to elevate the needs within leadership, even within our system, to understand what's happening and understand the importance of this.
Thank you so much. Oh, Dr. Samko.
Yeah, so I mean, the governor has, stated that similar to abortion services, like trans services, will continue to be made available in the state of California. And to your point, I think that we at LA County in our service provision of marginalized populations historically is at a really critical point to be able to provide some of that care. And we are hopeful that we'll be able to expand so that we will be able to see patients, not just with our insurance type, but with other insurance types to give better access to communities. And I do see some of the questions in the chat about payment. To be very explicit, Medi-Cal pays for all of these services. It pays for hormones, it pays for surgery. If it is for gender affirmation, it is considered medically necessary. So it pays for electrolysis, it pays, all those surgeries you see listed, it pays for hormone blockers, for the voice training. It does not pay for fertility preservation. So for patients seeking fertility preservation, either oocyte or sperm preservation, that is an out-of-pocket expense that can be quite pricey. And there are some scholarships or ways to apply for partial coverage of those kind of services, but Medi-Cal covers all of these services that are listed here. And restricted Medi-Cal, when they're accessing services within DHS, covers all of the services that we offer within DHS. It's when patients do not have either fee-for-service Medi-Cal or Medi-Cal with a plan that they might lack access to some of the services on the next slide that require referrals out of the network. But for those who have Medi-Cal, either fee-for-service or with a plan, they can access all of these services covered by their insurance at an outside site. So just to be very explicit, it's covered.
And we did have a question about immigration status. And so my understanding is that My Health LA is program participants in My Health LA are also eligible for services.
Correct.
Right. And I think, as was mentioned, it sounds like the right place to start might be to, call the Alexis Project and to learn more there for any of those specific questions, or if you have a referral that you'd like to make for someone in your network, this is kind of the good place to start. And ideally, you'll be connected to someone like Dr. Samko or Dr. Gardner for further conversation and consultation. Are there other questions that people want to ask? I apologize. I'm trying to stay on top of the chat. There's a lot of wonderful feedback, just really appreciating everything you do. The services you provide sound amazing. And I think that the community is incredibly grateful that such a range of services with such compassionate providers are available to our community residents.
We do have a flyer. It's a little outdated. I'm waiting on an update from our PIO. So I'll reach back out to Connie to see if we can get an update to that flyer. And then I can share it with you and y'all can distribute it.
Fantastic. Wonderful. And I don't know, Monica Alcaraz, I see several questions from you. Did you want to ask any of your questions out loud, or do you feel like you've gotten enough information thus far?
No, I think she answered the questions. I mean, a lot of it was accessibility, low income, kind of like who pays for it. I think it's wonderful that Medi-Cal helped pay for some of this. So, and I know that, people struggle with that. So it's good to know.
So thank you, doctors, so much for joining us today. And we look forward to getting that flyer. We will send the flyer out to our distribution list. And as always, our meeting materials, including this presentation, a recording of this meeting, will be made available on the hicpla.org website. So if you want to kind of follow up, learn more, or refer someone who maybe wasn't able to join us today to learn more about the services, please direct them to our website. And then, of course, to the Alexis Project to learn more. Any final thoughts or comments? All right. Well, just thanking you again. And thank you, Dr. Gonzalez, for coordinating this presentation today. We're really grateful to learn about some of the really specialized services and, of course, I think we see the incredible kind of passion and commitment to patients that so many of our DHS providers have. So thank you all so much for joining us today. I really appreciate the information. Okay, next up, we have another update on our fantastic General Hospital West Campus RFP project. With that, I am delighted to have Rosa Soto and Doug Cohen join us to tell us about what new developments are evolving with this particular incredible project.
Well, I think I can jump in right away if you want, Heather.
I would love that, Doug, as always, please.
Okay, so we're advancing to slide 2 already. Good morning, everybody. This being November 4th, on November 1st, Tuesday, we had a motion passed that was carried and it additionally secured the funding for this RFP process. So again, the RFP is a request for proposal to the development community to provide a very transparent bid process upon which a developer would be selected for the redevelopment of the overall campus. And there's an administrative component to support that effort. The first of which is identifying funds, county funds, that can be used for the various consultants that go into the process of building this RFP document. We've identified a close working relationship with the foundation with respect to the allocation of some of these funds and these resources to onboard the consultants. And the motion that was carried on Tuesday authorized $300,000 through my agency that I work for, Department of Economic Opportunity, in conjunction with the contract that the foundation has with the Department of Health Services, to identify $300,000 of contracting authority for consultants, again, to support the release of the RFP. There was a second directive in that motion from Tuesday, which essentially was the same item. It's just that we applied an additional $200,000 to the same contract relationship that DHS has with the foundation. And so that allocates $500,000 of contracting authority through the foundation's contract with DHS to support the effort to really release a very comprehensive and thorough RFP document. In addition to that, the Department of Economic Opportunity, which is responsible for the drafting, the posting, and the overall management of the RFP and selection process, we have authority in that motion to do whatever else is necessary outside of the foundation's contracting authority. And so the motion, we've been moving forward on the RFP process since May, with a full effort since May of this past year. However, the actual structure of the flow of funds and the contracting authority was really formalized on Tuesday. So it was a big step. If you could advance to the next slide, I'd appreciate that, Heather. And so excuse me. And so one of the items that we talked about through the summer when we first started the RFP process was how to identify and prioritize the expectations that the community has with respect to what could be part of this final development and build out of this campus. And so at this time, we've established the application process for the Community Priorities Advisory Committee. The committee will review, assess, and summarize community guidance documents, and then they're going to deliver a concise summary of the community priorities in order to support these future opportunities. The applications opened on the 7th of October, and we are currently in the process of reviewing those applications. What we're hoping to do is to have a deliverable from this committee that can be reviewed during the month of December. Now, that's also coincidentally a parallel timeline with the drafting of the RFP. And so hopefully we're looking for some coordination and some supporting cross utilization from what the committee does that could possibly be incorporated into the RFP itself. And that is the update for since the last month.
Thank you so much, Doug. Rosa, are you going to take the rest of the slide deck and read us through some of the highlights of where we're at?
Sure. So just to give us a little bit more context in terms of, and good morning, everyone. Rosa Soto with LACUSC Medical Center Foundation. Want to appreciate, our county partnership and the incredible leadership that comes to this meeting that has entrusted, the relationship of the foundation to be backbone to HICP, but to also support with this continuum of community engagement. And we're excited to ensure that the consultants that are brought on expediently and are able to truly be that important asset that Doug and the DEO team need in order to push forward the RFP. Also, much appreciation to our supervisor for continuing to support this equity space. So as we think about the the role of this committee, right? I wanted to make sure that we touched again on what is it that is complex about where we're moving and how we're moving, right, toward an RFP and toward a future development of the campus. And so reminder and acknowledgement to our CEOs team who are on today, to acknowledge them for the incredible work of the reuse framework, as well as the feasibility study as a whole that was presented in the summer. So what the committee will do is it will be looking at those priority documents that the community has informed, such as the community meetings that we held in 2019, the reuse framework that is within the feasibility study, the priorities set through the feasibility study. And what's complex about that is that with a county asset like is the General Hospital, and Doug, you can help me with this, is that there's competing priorities, right? There's the priorities of the county as a whole to its asset that sits on the grounds of LACUSC Medical Center, which is one of the largest hospitals in the country, that straddles county and city land, right? And that has, these competing priorities around, the surrounding community needs, as well as, how we serve our patients and how we continue to provide essential services that are currently being run and housed within the facilities that are in the footprint of this work. And so it's so important that we take that step back. And it was actually something that was requested from our community groups, in particular, Eastside Leads letter and a few other, comments that have been given through this process, that we need to continually revisit those community priorities and uplift their importance. So this committee will help us take a look at those documents and craft that fresh, priority list that will help continue to inform the process. So what will we do? We'll look at the, all of the different areas that are part of our framework for the Health Innovation Community Partnership, and then, ensure that there is, some guidance to how you look at each of those documents, what each of those documents are saying, and how do we truly deliver a concise summary of those community priorities to our future interested development, right, partners, and also to Doug and to the group that will be completing the RFP process. So wanted to make sure that we touched on that for those that, continually are wanting to become informed and to share with our community who are interested. And one of the things that I do know is that there has been a lot of interest in the committee, and we have a diversity of those that have participated in previous, iterations of our prioritization and advisory committees, but also, new folks that have been very active over the last year in these meetings. So just thanking everyone so much for prioritizing this as part of your time investment with Health Innovation Partnership. And, and again, as the timeline says here, we will be notifying, over the next week. So thank you. And take me to the next slide. Is there another slide after this? Yes, there is. One after this.
Yep.
All right. And so the next piece that is in the feasibility study is the summary of the reuse framework. And again, as I was describing, the community priorities and uses, the county requirements, and the technical considerations, and how each of those sort of inform, right, the overall opportunity that exists, but that it would really be important to ensure that there is a guidance of how these tools are used from a community's perspective, right, for those that are most interested in applying for, the future development opportunities on the campus through the potential RFP.
And Rosa, I'm going to jump in just a second. It's if you look at this slide that is in front of us right now, each one of these points becomes a really significant area of breakout discussion in the drafting of the RFP. I mean, if you look in the middle section here of county requirements, the first 2 points, they just seem like bullet points on a page. Very significant discussions. A lot of complexity goes into making sure that we understand what the needs are for the community, for the continuity of operations. We don't get to just clear out the site and then have the developers come in and build new facilities. There's a whole continuity of operations for this, campus that's nearing 100 years old. The construction began 100 years ago next year. And so there's a tremendous reliance on continuity of operations. And we have to build in the avoidance of disruption as part of this RFP. So we're aware of that and we're sensitive to it.
Thank you so much. And then the next, steps for the community engagement is to host industry days. This is also part of this commitment that we're making in partnership with Doug and the DEO, is that we will ensure that the space is accessible for interest, right? And I like to say, for people to fall in love with the project, right? Because sometimes when you look at all of those restrictions and those requirements, right, they can be interpreted, depending on, people's level of interest and expertise in different ways. But I absolutely know that many a times when people come into our building, there's that wow factor, like what a beautiful building, what a beautiful symbol, right, of the history of good care for our community, but also, just where it sits and what it means to our community, right? Like the stone mother on the hill, the beautiful art that we have, the fact that it's going to be registered as a historic building. All of those things are so important. And so our hope is that we bring some of you that are part of HICP to also share what does the space mean to you, along with those who might be interested, and ensuring that we highlight that history, that scope, that scale. We embed community voice, right, as a key element of the project's intention and success, right? That we ensure that people are really close to the project. And as I say, fall in love with the project and this opportunity. As much as I know, my team is, we are, who get to be in the building every day with the Wellness Center partners, the Navy Training Center, and many of the staff that are housed within our building. So that's what will happen next. And so the first event will happen in December. The second event will happen January, February. So that's our latest. For those that have applied, you will be hearing from us in the next week, about week and a day or two. And we will ensure to give you an update in December on our progress. So I do see a few questions. Let's take those, Doug.
I'm trying to pull the questions up. Could you?
So there is a question about why are 2 helipads needed? And again, acknowledging that the feasibility study was presented by our CEO's office, Kelly Quinn, and I believe Ivan Matthews is on. If anyone else wants to help answer, or even our very own Jorge Orozco, our CEO, we would, welcome anyone. But go ahead, Doug, if you have some feedback, and then we can open it up.
Actually, if Kelly and or Ivan are on,
so I'm on.
Okay.
And I don't know if Ivan's on. Sometimes it looks like I'm also Ivan. But I believe he's off today. And I don't know if Jorge's still on because Jorge could give the definitive answer. So, but I can try. Is Jorge on still?
I
Or
do not see him.
Or Edgar?
I am
Maybe he
here.
is. Oh, he is there.
You
Yeah, yeah.
are. Then I will give it to you, Jorge.
Yeah,
question-
so
Well, hey, I'm on the call too, Angela.
okay, go ahead, Angela. You have more background than I do on this.
Good morning, everyone. So really, the two helipads have really been critical for general hospital operations. There are some sizes of helicopters that are not necessarily able to be accommodated. So that's really where the second helipad has come in when there's been talk of the master planning for the hospital campus. And it's really just with the intent to be able to take in various types of helicopters at the hospital and really kind of address various urgent needs that need to be flown in for critical care.
Thank you, Angela. We also had a question about the Eastside Leads Letter and other public documents. I just wanted to share that the feasibility study and the report that will be done by this committee will be available on the hicpla.org website. So I think that's probably your best place to get the most comprehensive set of documents. Any other additional questions about the feasibility study, just the next steps for the General Hospital West Campus project? We're very excited, as we say, to be forming our Community Priorities Advisory Committee in the next week, working together to deliver that report by mid-December, and of course, hosting industry days to, as Rosa said, really excite that interest and that enthusiasm for the project as broadly as possible.
And so if I don't see any other comments, I just, again, want to make sure that, this, this project is accessible to everyone. So if you're interested in, looking around, taking your own sort of peek around, we are open every day, but we will have these intentional, industry days and tours, right, to ensure that there is a guided element to, where the opportunities are on the project. So back to you, Heather. Thank you for the opportunity.
Thank you so much for the update, Doug and Rosa. We always appreciate it. All right. So next up, we have several really interesting updates on things that are happening in developments and the local area around the LAC-USC Medical Center. We have an announcement and a presentation coming up for you. First up, we have an announcement from the Los Angeles County Development Authority, who are unfortunately unable to be with us in person today. I don't know if someone from the supervisor's office would like to make this announcement, or if it's all right if I go ahead and read it.
You could go ahead, Heather, not a problem.
Okay, thanks, Guadalupe. As mentioned, we have an update from the Los Angeles County Development Authority about the permanent supportive housing project that is at the kitty corner to the LAC-USC Medical Center at the corner of Zonal and Mission. This is the permanent supportive housing project that's been discussed several times at the HICP table as part of our Restorative Care Village initiative. We wanted to make the announcement that LACDA and the county will enter into an exclusive negotiating agreement with Century for development of the affordable housing project on that site. The scope of the project currently includes up to 300 residential units, of which 50% are designated as special needs units and 50% as affordable senior units. As mentioned, this is part of the larger LAC-USC, soon to be renamed, Restorative Care Village project, and it has a total of scope of 2.3 acres of land dedicated for this permanent supportive housing project. We're delighted to invite Century to provide a further update at next meeting on December 2nd. You may remember, if you participated last month, that they did a presentation on their Bienestar project that will be part of the permanent supportive housing. The big announcement today is that as part of the outreach efforts, Century is looking for HICP members to be part of a subcommittee to provide feedback on the proposed development. If you are interested in participating in that feedback process for the permanent supportive housing project at the corner of Mission and Zonal, please put your name into the chat, your name and email address into the chat, or go ahead and email that information to info@hicpla.org. We'll also be sending out an announcement after this meeting inviting people to join the committee to our wider stakeholder database. So that is our announcement about the Permanent Supportive Housing Project. Thank you so much for putting your interest into the chat. Once again, please feel free to put your name and email address if you'd like to be part of that Community Advisory Committee. Next up, we have a presentation by our colleagues at the Department of Regional Planning about the Metro Area Plan. I'd like to invite Patricia Haichia to join us and give a presentation.
Hi, good morning. Can you hear me?
Yes, we can. Hi, Pat. Nice to see you.
Nice to see you too. Okay, so go ahead and forward the slide. I think you all have heard from previous colleagues about the Metro Area Plan, so I'm not going to repeat too much, but just wanted to remind everyone of the major goals of the project to consolidate and update existing policies and regulations, some of which have been in place for decades and haven't been updated. So that's one of the huge goals. Of course, we're prioritizing equity and environmental justice in our efforts. We're looking to help provide more and better access to open space if possible through our efforts, address housing needs, and to through what we can to facilitate potential more employment opportunities. Next. So I think I was asked to talk a little bit about two of the new zoning categories that we're actually creating as a part of the Metro Area Plan. So this is in response to some of our industrial areas in the Metro Area Plan communities that tend to have existing industrial uses that are not dirty, that are dirty and not compatible with sensitive uses and residential communities. So also there was interest in just connecting with economic development efforts in the county, looking at potentially providing more life science facilities in places. So in response to those things, we created this life science park zoning. So the wording that I'm using here and also the examples of permitted uses, this is all draft form. I'll mention this again later, but we are releasing the draft ordinance that will have this language starting in mid-November for everybody's review. So this is just an example that I'm presenting today, and you will have an opportunity to look at the language in totality later on this month, 2 weeks. So the intent of the life science park zone, this is a new zone in the zoning code. It will provide quality employment opportunities and support emerging technology, entrepreneurship, and innovation. It will allow for life science, research, and development uses, especially supporting bioscience and biomedical product development and manufacturing, and will also allow for administrative and professional offices that support these uses, and also allow basic services such as grocery stores and childcare that would serve local employees and neighborhoods. So it's going to be a much lighter industrial than some of our existing industrial zoning. And examples of permitted use include labs, film labs, which will require CUP, biomedical and pharmaceutical development that will also require conditional use permit, CUP, development of microchip, tech chips, research and development, motion picture processing and motion picture sets, hospitals, which will require CUP, medical clinics, which will not require CUP. If there's potential for acquisition for park space, we will permit parks there. Childcare centers, or if private developer comes in and does more of a master plan model, we can ask them to provide park space. And then warehousing is still a need. Many of us have been using products that are through our online ordering, and things are packing up at the ports. So warehousing remains an important use for LA County, and there's definitely a demand. So, but sometimes they do create problems for the community. So we are changing the way we permit warehouses from just a simple site plan to a CUP requirement in the metro area plan communities. So I think that will help provide more community feedback when these applications come in. Next, the other industrial zone that we're creating is called the Artisan Production and Custom Manufacturing. And the intent of this zone is to provide neighborhood scale urban manufacturing use opportunities, such as production, design, distribution, and repair of products, including but not limited to furniture, art, software, technology, and other custom-made products. Also allows for neighborhood service, commercial services, and innovation uses compatible with surrounding residential uses. So what we mean by that, if you look on the other side, the examples that we have there are jewelry and clothing production, craft production, film labs, which will require CUP, microbreweries, which will also require CUP, artisan production and manufacturing, shared kitchen complexes, parks and childcare centers, and again, warehouses. Next. So this is a map. So we are proposing, as you know, where to put those two new zones, as well as address housing needs by rezoning parcels. So I know this is kind of small, but if you go on our website, you can download the map for yourself. That's further on in this presentation. You can go to the link. This is just a screenshot that I took of the map. But if you know the East LA shape, then you can see like the north of the, I think that's the 10 freeway, the City Terrace area. That's right now, I think it's zone M2. So that's where we're putting the LSP designation, the Life Science Park designation. And then in the hatch mark is where we're putting that artisan production and custom manufacturing. Down toward the middle, there's a little bit of industrial that we're making, right, thank you. And then further south, near Commerce, there's also some industrial that we're making into artisan manufacturing. So, and then with regards to housing, I think Isla, my colleague Isla Scott, came in August and talked about the housing, where we're rezoning for housing. You can see on this map, but also on the next map, we can show more details on that. So can we go to the next slide? Right, so this is in response as to the housing needs. I think you all know that the state has mandated local jurisdictions to rezone for more housing. And so the way that the LA County was given a huge number. And so a lot of our area plans that if you follow our department, we're doing a lot of new area plans that are trying to address this rezoning issue. For East LA, we are redesignating along commercial corridors, along Whittier, Atlantic, and Beverly. And so the minimum density would be 50 units per acre and the maximum will be 150, but they will be mixed use. So bottom is retail and office, and then on top would be residential. And there's a link to an interactive GIS map. If for those of you who like to play with interactive maps, you can actually, I think, go zoom in and zoom out and maybe even find certain properties. This is a screenshot of that interactive GIS map. Next. So I think you may have seen this timeline before. It's on our website. I will go into more specifics on this, but this is the general overall project timeline. So right now we're in 2022. This is November 4th, so we go to November. we just released the draft metro area plan document with the land use and zoning change maps. It's all on our website. We released that on Halloween, not to scare people, but that's just the date that it fell on that worked. And we already received a request for time extension. Originally, we were going to have that comment period go to the end of the year, but we're extending that for a couple more weeks. On December 7th, I'll put that on the chat. We are planning actually a public review workshop on December 7th that will be online and recorded to walk through the draft area plan and the soon to be released ordinances that will talk about the zoning and the specific language of the zoning and the new standards that accompany the zoning, and as well as the EIR. And then in April next year, so then we're going to take back all the comments, then we're going to revise all our documents and come back to the Planning Commission at the end of April. But of course, we release our documents 30 days before the commission hearing, but we will plan to go to the commission late April next year, and then hopefully then a few months later to the board, and then final adoption October next year. Next. So the link is there for our documents, all our documents. If you want a simpler link just to look at the project website, I'll put that in the chat shortly. The draft area plan. So we were asked for somebody already asked us for a time extension to review the document. So the public review period is October 31st to January 16, 2023 at 5 o'clock. And then we're releasing the implementing ordinance, which is another way to say zoning code changes. That's going to occur. We're releasing that on November 17th, which is a Thursday. And that will also go to January 16, 2023. And on that day, we also plan to have our story map of the map changes available so you can play with the GIS map. And then also on November 17th, we are releasing the draft environmental impact report for this project and the implementing ordinances. All your comments and questions, you can always reach us at metroareaplan@planning.lacounty.gov. And even though our official comment period is these dates, we will talk to you until the board says approve. So there's still obviously many months of conversations that we can have, but this is just so that we can take what you give us and put it into the documents so that the decision makers have a document that they can work on, but you can always talk to us. So next. Again, that's our contact information. We also have a phone number that you can reach us at. We actually have a Spanish line that I'll put into the chat also. So yeah, that's it, I think.
Okay, oops. Thank you so much. Pat, we really appreciate it. Do we have, I see a hand raised. Greg, please ask your question and followed by Alex.
Thanks. So I guess just some question about the rezone in unincorporated East LA. Those densities, you said the densities were like between 50 and 150 dwelling units per acre. I mean, that's intended to meet the obligation to rezone for lower income housing.
Right, so the state requires us to rezone for like different income levels, and based on just like the way housing works, usually when you can have more units on a piece of property, then you're more likely to be able to put in affordable units. So we do have affordability requirements on some things, which my housing colleague is not here to talk about how that works, but I do have some. I think somebody posed some questions that I can respond to on that.
Okay, yeah, I think that maybe was getting where I was going, is that what additional policies might be in place so that the units are not just at those densities, but actually have affordable rents. Is
Okay.
it being upzoned through a value capture mechanism?
Okay. Yes,
Yeah.
I have, I'm gonna read the response that I think somebody gave me these questions. I'm gonna read the response that my housing colleagues gave to me. So if you're aware of the county having to develop a housing element document that has a lot of requirements. So the housing element law that comes from the state already addresses affordability by requiring 20% of the units in a housing development to be affordable to lower income households on lots that are being rezoned. On lots that are being upzoned to accommodate lower income units. So that would be these parcels. So 20% affordability requirement. And we are adding this requirement into our zoning ordinance that will be released on November 17th. So that language will be there. In other words, where we upzone to meet the lower income requirements that the state mandates, they also mandated this, this is called an inclusionary requirement, this 20%. All we need to do is to add this state requirement in our zoning code so that this requirement will kick in when the rezoning is completed, which is when we adopt this in October 2023. That's the target date. For other lots that are not to be rezoned to meet the lower income requirements, but say are being upzoned to meet the moderate or above moderate income requirements, that's where our local inclusionary requirements will kick in. And this is why we are also working on an inclusionary housing feasibility study right now, hoping that this study will inform our housing ordinance update and will include a local inclusionary requirement for lots that are not subject to the requirement under what we just talked about right now. So let's see, this study is, we're not sure when that's concluding. I think somebody asked us if we're done, we're not done. But we are doing a lot of updates to our other housing ordinances, and this will be completed by late 2024. Does that make sense?
Yes, thank you. And yeah, that was a good reminder about the state law requirement to have that 20%. I think that is set at the low income, what's defined as low income, which might be more like 60% AMI maybe. And honestly, I can't remember if it's 60 or 80. But a lot of folks in that neighborhood might not make enough money to afford the low income rents. And a lot of the other incentives might produce, very low income or extremely low income units. Are there any opportunities to try and make sure that the deed restricted units are at lower rents that would, so we could be sure that the community members could afford them?
I can't speak to that. I'll take this request back. I don't know the answer to that. So I do know that the planners in our department are very, very, very aware of the housing needs for lower and very low and extremely very low. I mean, we're all educated and understand that that is the biggest need, and where we can, I do believe all of us try to advocate for that to be included. And I think the county is also making effort to encourage 100% affordability type projects, and not just rely on the private market to provide the affordable units. As you know, sometimes it takes a lot of arm twisting to get private market to do any of this work, which is why these legal requirements had to come in. But I will take this back just as another reminder to our team, the need for lower income and units. So for sure.
Okay, thanks for the answer. Thank you.
Yeah, of course.
Thank you, Pat. We have another question from Alex. And Alex, nice to see you.
Good morning. Good morning, everyone. Good morning, Heather. Hi, Pat. Thank you for the presentation. I wanted to ask 2 questions. One regarding any efforts in consideration to toxic remediation or any efforts in what are those efforts, if any? And the other is in consideration to, was it on the last slide? Oh, so speaking of any contaminations, you were referencing City Terrace. I'm resident, so very familiar. So any considerations taken into Whiteside and surrounding areas and other areas that would have been affected by any historic pollutants? Do you
I
generally?
think our department, we don't, that's not one of the things that we have authority over. These are all private property. We can require them to only allow for certain uses. But I can tell you that at least I know for certain that in cases where there's a conditional use permit requirement, they have to go through the California Environmental Quality Act assessment, which a lot of times asks them to investigate for at least do a cursory review of contaminants. And if they're developed for residential uses, they definitely have to address some of those issues. So the cleanup will come during the development, but our department, the county can't just like go onto people's private properties and start cleaning up.
I'm very familiar.
Yeah.
Yeah, I'm very familiar with the process, and I would never suggest that that's what the county's responsibility would be, but to, in the authorship of this document, make it at least aware that these major changes will require them to, at all stages, 100% acknowledge that in industrial or historically commercial or industrial industrial areas, be completely contaminant free before moving in the process. Just because they were reassessed doesn't mean you're moving into a residential area, and especially the adjacent areas. So like with the Vernon issues, we had areas that were cleaned up, and then the areas adjacent to them were still contaminated, even though a residence will now be unaffected because of the ground beneath them, but the adjacent neighbors will property, empty lots, etc., will still have contaminants available. So there's an amount of responsibility to the authorship of any document that changes the use to make these property owners aware that the land that that they're now going to be allowed to develop on be cleaned up.
Thank you, Alex. Oh, I was going to say Guadalupe raised her hand.
We can research that and see what we can do.
Thank you, Pat. I was going to mention that Guadalupe from Supervisor's Office raised her hand. I wasn't sure if that meant she had a comment potentially in response to Alex, and then we'll close with Pam's question. So Guadalupe.
Yes, thank you, Patricia, and thank you, Alex, for the question. I know environmental equity has been always, a very key element, and we're always looking at ways how we can use our, planning and zoning elements to uplift, incentivizing uses that are also, they're cleaner and I know the Whiteside area, the community has always been very vocal. How do we turn that pocket around? And that's why planning has been working with folks from that area, and they came up with a new zone to discourage and to have more, cleaner manufacturing industrial uses, but also inviting neighborhood friendly uses, because I know that area, especially the residents that live there, they have voiced that they want to be able to have amenities. They want to have it be more friendly uses to nearby residential, and also that's building in addition to the green zones as well, that there's also an ordinance that was adopted by the county to also discourage certain uses, right? and provide certain standards, development standards, again, to make it more friendly to the residents that are there within that area. And but I think especially these industrial areas where planning is, we're coming up with a new zone for those two areas. They have that in mind, how do we, better direct future development in that area that's more compatible and friendly. And, so those are some of the other efforts on environmental equity that, we're looking at as part of the map. And definitely we invite all continuing, feedback from the community to see how we can, just improve upon, what's recommended.
Thank you, Guadalupe.
Thank you,
for that.
Guadalupe.
Just to transition out, the other question real quick was going to be, please, I hope your document includes the analysis that would, any analysis of the impact of population density. We're jumping up pretty high there in some of the areas. I'm on Beverly Boulevard myself right now. And again, I'm a resident of City Terrace, so I'm aware of a lot of these areas. I'm very aware of these areas. So any information on any analysis done for a projection on the impact of population density, a jump that high in some of these areas would behoove us to take consideration of that.
Thank you for the comments. I think we'll take our final question from Pam. Pam.
I'm trying to unmute. Hi, Pat. I first want to clarify a timeline concern. I heard you give a date of late 2024 as you were, sharing information with Greg. Can you just remind me what was that late 2024 adoption? Because when you shared the metro area plan timeline, it ends in 2023, but then you mentioned late 2024.
Right, that has to do with the housing ordinances. So there's another group, Tina Fung is my co-lead on this project, but she's also in charge of the housing policy group in our department. And so they're doing what they're calling internally the mega housing ordinance, and because they're trying to update the inclusionary housing requirements based on the study that they're currently running, and also other updates to the density bonus ordinance. And there's a whole lot of stuff going on there. So that's like a separate project that they're running, which will be completed in late 2024.
So Pat, with that, does that include that inclusionary housing ordinance?
Yes.
So a concern that I just want to flag here, and I think we've shared it in the past with your colleagues when they come here to this space as well, is if we will upzone private lots, we must ensure that inclusionary zoning policy is adopted before the county can allow that. And right now, when I see the metro area plan timeline that the adoption hearing will be in October 2023, that seems already to be a disconnect in timeline. So it was our hope, at least speaking for Eastside Lead's part, that inclusionary zoning ordinance would be adopted before the adoption of MAP. Or, yeah, right, so we can ensure that that benefit ties into whatever MAP will create now, the rezoning, the upzoning. So I just want to flag that, and what do you think there's space for more discussion on that in December, in our December meeting for CAC?
I think you might want to send a separate email and just ask to talk with Tina separately. I think you have her email address, or if not, I can send it to you. But I think a lot of it has to do with just like resources, staff resources, and the way state law is coming down, and just our ability to process everything in the order that we want to or need to. Like, so I can't speak to that. I can tell you, I can go back to her and reiterate what you said, but even she may not have control over staffing resources and how quickly we can work on some things and not others. So I will bring this back to her, and you can also reach out to her separately if you'd like.
Okay.
Yeah.
Yes,
Thank you.
again. And that's it, I think, because of time. Thank you, Heather. I know you were about to interject.
Oh, I was going to say thank you, Pam, so much, but I was also going to say, Guadalupe, do you have any final comments? I know you put something in the chat as well. Do you have any final closing comments on this segment?
No, just I think you know, just want to support, you know, Pam. You know, I think definitely, Patricia, let's bring back that you know, the request to see how we can fold in, you know, that discussion of the IZ with the map, because that was the intention, I think, all along. So we'll follow up on that. And second, I think there was there had been a message that we had received, whether if there's any upzoning, is there any impact to any properties that may have tenants already occupying that could be impacted with the upzoning, because you know, you incentivize redevelopment when you upzone sometimes. And is there any strategies in mind in regards to that potential activity? I think that was one question we have received. I don't know if there's any thoughts on that.
Yeah, I have a response for that. So back in I guess August of last year, when Isla came, she did provide a breakdown of sites in East LA rezoning, and based on her research, there are only 8 lots among those being rezoned that have existing residential uses. The majority of the rezoning sites are solely used for commercial today. So this is to give everyone an idea of existing residential tenants. The impact of the rezoning will be very small in terms of the quantity. In addition, the Department of Consumer and Business Affairs is leading a program called the Tenant Opportunity to Purchase Ordinance right now. They just started working on this ordinance, and this would allow for a right to return for tenants who may have to move, but they would have the right to return. I don't know how that works exactly, but the Department of Consumer and Business Affairs is leading that right now.
Thank you, Pat. Thank you so much. Obviously, a topic of great interest to all of us. It sounds very exciting, all the potential that is embedded in these rezoning ordinances and bringing diversities of businesses and housing and other opportunities to the Eastside communities. And so we appreciate your time today and look forward to future presentations as this process continues.
Great, thank you. Thanks, everybody.
All right. So next up, we are really excited to kind of welcome our colleague Henry Perez from Inner City Struggle, who's going to lead us through a conversation about kind of the kind of happenings at the county level and how we're going to how we're embracing change and the community conversation and dialogue. So with that, I invite Henry to share his screen, which he has done, and to take the presentation away. Oh, Rosa, would you like to introduce the segment?
Yeah, I'm going to share the screen with Henry just for a second. And that is to give some context to everyone on the meeting. So many of you know that the way that our HICP agenda is put together is by a co-design team. And so this section of the discussion is specifically lifted by the co-design team that will bring up the opportunity within our space to address the importance of leadership and continued growth in how we address health equity and how and how we work to continue to do the work of anti-racism. So so this was very important because of what has occurred over the past month and for our community leaders. And so Henry will take us through a bit of the history of what has happened in the last month, and then facilitate our discussion along with our colleagues from co-design, for this discussion. So I just wanted to make sure to really acknowledge the strength of our community partners, who would like to hold space right, for community to have a voice within our health equity space of HICP. So welcome, Henry. Welcome, co-design team.
Thank you, Rosa. Good morning, everyone. Like Rosa and Heather mentioned, my name is Henry Perez. I am the director of Inner City Struggle. We're a 28-year-old organization here in the East Side, and we have been very engaged in this situation with what is happening in Los Angeles City Council. We have been engaged in this situation with a lot of partners that are both here in the HICP as well as throughout the East Side and the city of LA. I want to just first start off by saying that this is an unfortunate conversation that we have to have, right? That we are having today because of something that happened. I would first like to acknowledge the pain that many communities have felt, are currently feeling because of this situation, right? And the leaked, the audio recordings of that meeting, and also acknowledge the turmoil that this has caused on communities throughout the city. What I do want to say is that from these dark moments, there are also opportunities, right? There are opportunities to advance a vision of what we want to see, would like to see in our city and from our leaders in our community, and also new ways of doing things, right? But for that to happen, we have to do the work, right? We have to do the work, and we have to have these difficult conversations. We have to engage in these challenging conversations and commit to do the work that it takes to advance racial justice in our communities, in our city, and among our government. The purpose of today is what is the role of the HICP in the time of leadership instability in the East Side, right? Which we are feeling right now. So I'd like for us to think about this question, and we're not going to answer it right now. We're going to come back to it. But the question is, how do we use the health equity space, the space that we have all been participating in for years now, to elevate consciousness around anti-Blackness and also anti-Indigenous beliefs and rhetoric? And how do we promote anti-racist policies and elevate consciousness around equity and just policies and practices, right? So if you kind of want to already think about that question, we'll return to it and have an opportunity to weigh in on that around this question. But before we answer this question and provide just feedback and comments on this question, I think it's important for us to just ground ourselves with a recap on what actually took place. So I do want to say that it's a recap. It is not a position statement of this space, of this collaborative, right? The HICP. It's more of a recap that I myself put together based on just being engaged on this issue. So what happened? So there was a leaked audio recording of a meeting between 4 very powerful Los Angeles Latinx leaders, right? It's important to note that the meeting took place over a year ago during the City of Los Angeles redistricting process. So all of this really is in the backdrop of redistricting. And in the video, we heard some disturbing racist comments that were made during that meeting. And not just racist comments, but also homophobic comments, right? So we heard anti-Black comments, we heard anti-Indigenous comments, in particular about the Oaxacan community, right, in Koreatown. We heard homophobic comments, and we also heard attacks on Black allies and also renter allies. The purpose and intent of the meeting was to draw council districts that were beneficial to the 3 council members present in that meeting. So we heard, we saw, we analyzed comments that were like zero-sum game, like politics, right, in nature, that in order for certain people to gain, others had to lose, right? In order for certain council members, council districts to gain, other council members or council districts had to lose. There was conversations about accumulating assets for their particular districts at the expense of other districts. There was attacks on historically Black districts and Black political representation. And there was also attacks on renter power and influence by ensuring that renters did not become a dominant and influential group within a particular council district, and the council district where we have seen a lot of support for renters' rights and renters' protections, right? So actually, at this point, I want to pause and invite my co-facilitators, Pam, Monica, or Ari, if there is anything that you'd like to add about the recap. And if there isn't, it's okay. We can go ahead and move on. Okay. Doesn't seem like there's anything to add. Oh, Pam?
I do want to add one thing, and I didn't capture it, sorry, Henry, earlier. There was also an attack on a solidarity, I feel, between nonprofits and labor. And this came from Ron Herrera, right, when he was, talking about tension between a nonprofit in Koreatown and labor. So I just want to say it was, yeah, that's it. That was adding to the disturbing comments section.
Gotcha.
Pinning labor and nonprofit worker solidarity organizers.
The one thing I do want to say, Henry, I know in the presentation it says East Side, but understand that the communities that were talked about also, it's the Northeast Side, and that's where I stay. And I'm very familiar with 2 of the council members. And I'm bringing this up just because we're part, that's part of the HICP that it covers, and people always say the East Side, but it's also the Northeast Side, right? And where I live, particularly, 2 of the council members that were speaking service that area.
Yes.
So.
Thank you, Monica. Thank you for uplifting that. Yeah, and I apologize for excluding the Northeast LA, but yes, absolutely. So thank you for adding that. So the next part is what has been the community's response and what has it resulted in, right? So we have seen dozens of statements that have condemned the comments that were made during that meeting and have called for immediate resignations of all 4 leaders, right, that were a part of that meeting. There have been protests in City Hall, in Boyle Heights, in Eagle Rock, and I'm sure in other parts of the city as well, right? I believe a community, Cielo, that represents indigenous communities, also had a very large march and rally in the central part of the city. There have been disruptions of City Hall meetings, and the message there has been that there should not be any business as usual until all council members resign. And there was an 18-day encampment in front of Kevin De Leon's home. And it ended just earlier this week. That was held down by Black Lives Matter. Where are things at now? Well, the president of LA County Federation of Labor, Ron Herrera, has resigned. He was the first one to resign out of the four. City Council President Nuri Martinez has also resigned. First, she stepped down from her council president position, and then she ended up resigning completely from her council district. City council member Gil Cedillo, well, he lost his reelection. He lost his reelection in June during the primary. So his term actually ends in December. And he has actually been stripped of his committees. He has been censored by the city council. And he hasn't been present in city council meetings, but his term is going to end in a matter of like 4 to 5 weeks. Then City Council member Kevin De Leon, he has also been stripped of his committees. He has also been censored along with Council member Gil Cedillo. He has also not been present at City Council, requested a leave of absence, which I believe was not granted, but he has not been present. And he is on a media apology tour, and he has stated that he will not resign. He will not be resigning. Now, again, I'd like to invite Pamela, Monica, Ari, if you'd like to add anything in this section.
I would like to add something. I know that there is support for Kevin not to resign. And I'm not sure like how many people, but I know that there are people that are from the community that are asking for him not to resign. And I just wanted to put that out there.
Yeah, thank you for sharing that, Monica. So yes, that's correct. And then also, there has been a recall filed from a group in I think a group from like Eagle Rock that has filed a recall. We're not familiar with that group ourselves, but yeah, but there's been a recall filed. Okay, so
Henry, if I
yes.
may.
Yes,
sorry. Yeah, sorry, I am driving, so I'm not going to show my picture of my video. To number one, appreciate the question that you posed for us in terms of what do we do from a policy.
We lost you, Ari.
You know, where are we now? I'm sorry?
You were breaking up, but you're back.
Oh, okay. Where are we now in terms of what they were doing? The number one, representing the Latino community, fighting for representation of the Latino community, and also, you know, what is all this in terms of some deal that was made with the African American community in terms of boundaries and so on and so forth, which was kind of the central discussion. So my where are we now? There's a pending question, not just around who's resigning and who's not, but my concern is more around Latino community representation, the strength of that, and what we as HICP could help and how we could guide that. So that something like this, you know, why did this happen? Why did this conversation have to happen? So if we go back to that premise, we would say, well, what can we do now to prevent such type of having to negotiate boundary lines? So that's what I'm looking for in terms of lifting up our community power at that level. So thank you.
Yeah, good point, Adi. And I'll move on to the next section, and I think we may be able to touch on it here on what are we hearing on the ground and potential opportunities. And I think one of them speaks to what Adi was mentioning. But first, what we're hearing loud and clear is from the ground, right? And again, this is not a position from HICP, but just what we're hearing on the ground is that Council Member Kevin De Leon must resign, right? There must be accountability for his actions. His presence in City Council is making council meetings and business an untenable situation, or could make council meetings and business an untenable situation. We saw that when he did, in the very beginning, did show up to one of the council meetings, and the audience erupted in protest, and the meeting was not able to happen. This is a very unfortunate situation because there are a lot of there's a lot of business, a lot at stake, decisions that need to be made in City Council that are currently frozen because the council cannot operate right as it usually does because of the loud calls for resignation. And then there are several East Side organizations, and Monica, to your point, my apologies, I'm going to add Northeast LA organizations, leaders, and residents that do not want him serving as CD14 council member. And CD14 is definitely more than the East Side. To Monica's point, CD14 also includes part of Lincoln Heights, and part of Highland Park and Eagle Rock as well. So the Northeast is El Sereno as well, right? So that's what's happening. Potential opportunities that we see is opportunities for structural reforms, and in particular around the redistricting process. By creating an independent redistricting commission. I think this speaks to, I hope this speaks to what Adi was mentioning, that the reason that this happened is because one of the reasons that this may have happened, or it did happen, was that we do not have an independent redistricting commission in City Council, in their City Council redistricting process. What happens is that all City Council members, all 15 of them, appoint a certain number of representatives that then serve on a commission, a redistricting commission. But a lot of times, oftentimes, not always though, the representatives are there to do the council members' bidding, right? We even saw Inner City Struggle participated very, very strongly in the redistricting process. And we saw that certain redistricting commissioners were pulled out by their council member at the last minute, or very like in the middle or end of the process, because the council member felt that they were not representing their interests correctly, right? On top of that, this redistricting commission in the city of LA is an advisory redistricting commission, which means that at the end, the city council has to adopt, approve the recommended redistricting maps. And this meeting was about really preparing to scratch what the redistricting commission had done, and kind of redo the maps the way that they wanted to see it. Other people have talked about expanding the number of city council districts. We currently have 15 for a city of, what are we? A city of at least 8 million to 10 million people. We have districts that represent over 260,000 individuals, residents, right, per district. Many people feel that that is too large of an area for a lot of these council districts. So some folks, organizations are calling for more council districts in the city of Los Angeles. And also funding and resourcing a city Department of Racial Equity that could do a lot of work around racial equity, racial justice in the community. And then lastly, and I think this is where we want to focus ourselves on as HICP, is having the necessary conversations about anti-Blackness and developing anti-racist practices among our organizations, among our departments, with our leadership, right? But also with our staffs and our members, right? That are the part of the community. Like I mentioned, for us to be anti-racist, right? And really be in solidarity with our Black brothers and sisters, our Indigenous brothers and sisters, our LGBTQIA brothers and sisters, we have to be intentional about the work, right? We have to do the work, right? It doesn't just happen. We really have to do the work amongst ourselves, in our organizations, in our departments, and in our communities and in our families, right? So with that, we now want to talk about this, go back to this question, which is, how can we use this space to elevate consciousness around anti-Blackness and anti-Indigenous beliefs and rhetoric? And how do we promote anti-racist policies and elevate consciousness around equity and just policies and practices, right? So let me stop sharing real quick. So I know that there's like about 50 participants. It's going to be very difficult to have a conversation with 50 people. So what I did is I created a Jamboard, right? So we have a Jamboard. Let me go ahead and share that Jamboard. Where are you at? Just a second. Sorry about that. Give me just a quick second to locate the Jamboard. Okay, I think it's right here. Okay. So I am going to drop the link in the chat. Okay, so everyone has the Jamboard link. So if anyone has used the Jamboard before, this is the question that we're answering. And there are 4 slides. It's the same question, but it's just, since we're a big group, right? If there's too many people in slide 1, you can go to slide 2, 3, or 4. But basically, this function right here is the sticky note. You click on this, you choose whatever color you want, you type your sticky note, and then you save it, and then it comes up here, right? So everyone will have an opportunity to put your own recommendations here. We'll do this for a few minutes, and then we'll come back and see if anybody would like to share their comment and their suggestion, their recommendation. Sounds good. Heather, how much time do we have left? I know we may be close to time, but
yeah, we're getting a little close to time, Henry. Maybe we could do this for about 5 minutes. And then, of course, if people are challenged with the Jamboard technology, please always feel free to use the chat. We certainly can take comments made in the chat and move them to our Jamboard to be responsive to the community conversation. Thank you for facilitating this, Henry.
Thank you, Heather. So let's try 3 minutes. And then so that we can maybe come back and share some like 2 or 3 suggestions, comments. Okay.
Henry, can you go again through where to click for the, just do it one more time?
Yes, you click right here where it says sticky notes. Does everyone see my cursor?
Oh, left side of the screen.
Left side of the screen, click
fourth
it.
Fourth icon.
Yeah, and then you could pick whatever color you want. You just type it. And then once you type, you press save, and it lands right here. You can kind of move it around if you want. Okay.
Can I say something really quick? It's Monica.
Yeah, Monica.
You
can go ahead and start while Monica says something, and then Heather, if you could just time us. Go
Got
ahead.
it.
Yeah, I just want to say that the discussion that they were having is very common practice, not the anti stuff, right? Not that. Um we know that it's common practice for them to talk about the spaces. One thing I know that they city leaders always reach out to the community and have them, when they have these kind of like redistricting, like speak up about what you want. Like I was approached because I wanted more of my community to be part of city 14 because of the representation or the lack of representation from uh cd 1. So I think it's important for people to understand that, right? We are often like asked as community leaders to chime in on what the community wants. So as far as like discussion that they were having, I think is part of, you know, the fight that uh, of keeping what the community wants. So I just wanted to say that.
Yeah, Monica, I agree. I think it happens. And I think there's nothing wrong with looking out for your community and your district, right? I think the problematic part, at least, speaking for myself, is that whole zero sum like kind of game, right? Where you do it at the expense of other communities and with intentional, the intention of diluting power in other communities, right? For your benefit.
No, and I get that.
Okay, no, but thank you for adding that. Yeah, so please add your sticky notes. If it didn't work, I added, I think I had to make you editors instead of just viewers. So
Yes,
edit
you
that.
got that? You were
So
able to fix that?
maybe you need a refresh and it's there. Pam, yeah, it's working okay. Yeah, go ahead and we probably are down to maybe just 2 minutes now. And like Heather says, if you want to instead use the chat, go ahead.
All right, thank you, everyone. We're kind of at maybe 1 minute to go, so put those last final comments and thoughts in. And Henry, I turn it over to you to kind of do some synthesis and summary from what we're hearing. Oops, you're muted.
Yes, thank you. So I went ahead and stop sharing so we can see each other. So thank you all for offering your thoughts, your comments, and also most importantly, your suggestions and recommendations on what we can do as a health equity space. So keep them coming, right? The Jamboard is open. And I think the Wellness Center team will we'll review the notes and yeah, and hopefully find ways to implement your recommendations. I wanted to see if there was maybe two, Heather, three, you let me know, people that wanted to share what they wrote.
Absolutely. Please, we'd love to hear from you.
Anybody interested in sharing what you wrote? Yes, Pam.
Hi, everyone. I'll be quick. First, appreciating the conversation and know everyone that co-design also struggled, with this issue. I just want to say that this space and creating space to talk about these issues that are impacting our work, impacting our communities is important. My comment in the Jamboard revolved around the murder of George Floyd. As a reminder to partners, we had a conversation about racial equity and discrimination and how we can further this space towards, anti-discrimination, anti-racism at the time. The fact that we haven't had such a conversation or continued it since then, I think is important to acknowledge, and therefore bringing in that past conversation and this conversation now, let's continue. But again, appreciating you, Henry, the co-design team, and everybody in being part of today's conversation. And I'll pause there because I want to allow other voices.
Thank you, Pam. I see Monica's hand up.
Yeah, thank you. Thank you so much, Henry. I'm the one who wrote about the mental health aspects of all of this. I know I've cried quite a bit over what happened. And if I could ask, this health group to help the mental health aspects of all of this. I'm sure there's a lot of people who are also suffering. It hurt my heart tremendously that the words of those people were so antagonistic to Indigenous people, to LGBTQ people, to African American people, and I'm sure that those groups are also hurting, and then Latinos are hurting because it happened in the furtherance of Latino power, which is the most hurtful thing also, so many layers of pain are part of that, what happened. And I would like to see if we could somehow participate in some of the mental healing.
Thank you. Thank you, Monica. Thank you so much for uplifting that. Absolutely. That's very great suggestion. And I think, Heather, we're at time. Of course, the last thing, I wouldn't be being a true organizer if I didn't say this last thing, that as Inner City Struggle, we are very engaged in this issue. So if you, as an individual organization, are looking for a way to connect on this issue, to do something about it, to work with other organizations around this issue, please reach out to me. I'm going to put my email on the chat. There are many ways that you could get involved around this issue. And we are going to keep doing work around it and would love to have your support and your involvement. So I'll just put my name, my email on the chat, and you can email me and we'll connect. Okay. Thank you all very much for your time.
And thank you, Henry, for stepping in to facilitate, this discussion. Appreciating that our health equity space allows us the opportunity to learn from each other from different sectors, right, of our work, and appreciating that there are notes here about ensuring that it isn't large periods of time when we bring up these issues, because we need to utilize the space to grow as partners that build consensus. And so just appreciating that we have this opportunity. And so we'll continue to dialogue on how best to do this, on how to take some of the recommendations here and continue the discussion. And just again, to reiterate, this part of the presentation was put together by our co-design and by Henry, not facilitated by anyone at the backbone of HICP, nor of our supervisor's office. And again, because this is health equity shared space, right, it is an opportunity that we have to work together. Also, some of the recommendations that were mentioned are part of what's being heard in the community, not the position, right, of Health Innovation Community Partnership, nor anything that membership has voted on. So thank you again, everyone, for the opportunity. And Heather, I think I give it to you to close us out.
Thank you so much. Yes, always love to have these wonderful, rich conversations that focus on, a dialogue amongst many parties to kind of come to a solutions-oriented learning experience and opportunity to promote change in our communities. Thank you all so much for such meaningful sharing today. To wrap up our November Health Innovation Community Partnership meeting, I have one partner announcement. The LA Conservancy representative was unable to join us today, but she did want me to make sure to mention there is a Legacy Business Grant Program opportunity available. Round 1 applications are due December 7th, so you have exactly 1 month to apply for this program. It is a $5,000 award for 10 businesses that are eligible small businesses in the community that have operated and contributed to their community's history and or identity for the last 20 years. So we want to recognize and celebrate small businesses in Los Angeles that have really embodied the strength of local community and really been contributors to their community's culture and success. Please go to the laconservancy.org website. There is a announcement about the business opportunity. I will also put the flyers in the chat, and we will be sure to send them around as a part of our wrap up for today's meeting. That really concludes our time together today. Our next meeting will be on Friday, December 2nd. We look forward to seeing you then and to kind of updates from some of our development partners, as well as to continuing the conversation and reporting back on lessons learned from this meeting. Between now and then, I hope everyone celebrates a really wonderful Thanksgiving and November, and we will see you on December 2nd. Thank you so much for joining us today.